And then next, we're going to auscultate the carotid pulses, this time using the bell portion to be able to hear the lower frequency sounds. In order to do this, you have to instruct your patient to take a deep breath and hold, and I'll do the same. And exhale. And the same thing on the other side. Deep breath and hold. And exhale. You're listening for the crisp sounds of the carotid upstroke, and you're also listening for any sounds such as carotid bruits that may be present. Next, we'll move to the examination of the heart. And our first step will be appropriate draping and exposing the portions we need to examine. Mary, again, I'd like to lower the gown here in the front. We're going to expose the anterior chest where we need to listen to the heart. And I'd also like to expose the lower portion of the chest. And to do this, Mary, I'm going to hold your drape here, both above and below, and have you lift your gown up, if you would. This allows for her to stay covered as we lift the gown up. And then, Mary, I'm going to roll this here to keep your breast and your chest covered, but open up the area that we need to examine. First, we're going to examine the PMI, or point of maximal impulse. And for this, I'm going to place my hand on your lower chest, just feeling for where the pulsation of the heart is at its most. This usually occurs in the 4th or 5th costal interspace, in about the mid-clavicular line. It may be laterally displaced in someone who has an enlarged heart. In someone that has a large breast, you sometimes may have to ask them to lift their breast up to be able to bring your hand into this area in a comfortable way for the patient. And the next step is going to be auscultation of the heart. And I'm going to, again, just be very careful to maintain good modesty as I expose the portions of her chest that I need to listen to while keeping her covered. So, Mary, I'm going to use the cold stethoscope again, and this time I'm going to use the diaphragm. And I'm going to start at the right second costal interspace, which is the aortic area. And then I'm going to move over to the left second costal interspace, which is the pulmonic area. Now the tricuspid is just below that at about the 4th interspace here at the left sternal border. And you can listen to that both from above as well as from below here at the lower left sternal border. That, of course, is the tricuspid valve. And then we're going to move over to the right, the mitral valve, which is located over here at the apex of the heart. And in order to show you the apex of the heart, I've exposed Mary just a little more than we probably need to. But this allows us to hear the lower portion of the heart. And that's about the 5th costal interspace off to the side there. We're listening for S1 and S2 crisp heart sounds, as well as any extra sounds. And next we go back and using the bell to hear the lower frequency sounds. We listen in the same areas. Right second costal interspace, left second costal interspace, the tricuspid area, and about the 4th interspace, and the lower left sternal border, and then over to the apex of the heart at about the 5th costal interspace. And now We're going to make sure you're adequately covered as we finish the cardiovascular portion of the exam.
Okay.